The Hospital Association of South Africa is hosting an exhibition on the advances made over the years in medical care. That's at Century City in Cape Town. Policymakers, NGOs and nursing professionals are among those attending. For more, we cross to our reporter, Vanessa Poonah. Vanessa, good afternoon. Tell us about some of the groundbreaking innovations that are being showcased.
Good afternoon to you, and yes indeed we are coming to you from the Century City Convention Centre, where this annual Hospital Association of South Africa conference is underway. Earlier on we spoke to the CEO, who was talking to us about some of the discussions that will be taking place here, and among that of course being the role of AI in healthcare, and also a great theme of this conference, if I can just take it back to the theme, is of course accessibility of healthcare as well as sustainability of healthcare. And healthcare in South Africa cannot be spoken about without touching on the National Health Insurance Bill. And of course that is a session that just finished up a short while ago, moderated by the project lead for business for South Africa. And of course she joins me now, Professor Roseanne Harris. Prof, a very warm good day to you. So you had on your panel some actuaries, etc., and you were really talking about the NHI and the impact that this will have on South Africa. Now we know that the bill has been contentious for quite some time. It's now before the National Council of Provinces. You've listed some concerns and also some recommendations. Let's just talk about the NHI. Its aim is to provide universal health care. What are the challenges with the bill in its current form?
Yeah, so I think it's really important that as a country we move towards universal health coverage. We need to urgently make sure that more South Africans have access to quality healthcare services. So the concern I think that's being expressed certainly from Business for South Africa as well as my fellow panelists is that the way that the NHI bill is proposing to do this, which excludes a role for the private sector, is not really workable. The challenge is so large that we need to do it in a collaborative way. We need the help and support of both public and private working together in order to move the healthcare system forward, and that's the plea.
So you're talking about issues around the single funding model. What is that to the layman out there?
Yeah, so what the NHI bill currently proposes is that the NHI fund would be the only purchaser of healthcare in South Africa. So the only way to access healthcare would be for the set of benefits that are covered by the bill would be through the NHI fund, and of course that's very risky, right? If you put all your eggs in one basket, it's very risky, and so what is being proposed is a more collaborative approach, which is likely to be realized a lot more quickly than a single fund model that will take a long time to put into effect. And it also means that that single fund is entirely dependent on tax to fund it, as opposed to a multi-fund approach where those who can afford to provide for themselves are then given an opportunity to fund their healthcare, but in a more integrated way than we currently have, so that you build in a common framework. Just like we did as we went through COVID, we had a common framework for addressing the crisis, where everyone had access to healthcare when they need it. We can do that in terms of building a workable NHI model.
Among the recommendations I read very briefly is amendments to Section 33. Explain to us what exactly those recommendations are.
Yeah, so Section 33 of the bill is the one that deals with the role of medical schemes. And it already now, before we've even started, proposes a significant restriction on the role of medical schemes once the NHI is fully implemented. So we've got a long road to travel. And the concern is that if you impose that limitation on the role of medical schemes, you're effectively excluding the whole private sector from supporting the implementation of NHI during that sort of potentially lengthy transitional process. So by making that a section of the bill more flexible, more collaborative, then it'll mean that during that transitional period we'll be able to actually build that framework that is actually going to work for South Africa. So it means that the medical schemes would operate in support of the NHI fund rather than being excluded from participating in providing care to South Africans.
So you've made your business case or your submissions to on the bill to the NCLP. Where to from here?
So the next step is hopefully for participation in various hearings. So the submission, as you say, had to be made on Friday. The next step is then consultation. So the various provinces are hearing public input, and the various provincial legislatures are also going to be hearing input. We, as B4SA, are certainly, and BUSA, are going to be participating where and however we can, and looking at ways in which we can communicate this willingness to collaborate to build this workable health system. So hopefully that will lead to some amelioration of these provisions of the bill. It's not massive changes. It's simple ameliorations, which will actually mean that we have a legislative framework that everybody can work with to build a better health system for South Africa.
Earlier on, we spoke to the HASA CEO, and he was talking about innovation, and he was talking about advancement in terms of technology and the use of AI in healthcare. Bring into the context of the session and the panel that you just moderated, what impact will there be in advancing medicine through the use of AI in the context of the NHI as it stands, which you have certain challenges with at this point in time?
Yeah, I think that's an excellent point. I mean, the need and the opportunity for us to use these technology advances to expand access to care. I mean, that's the really exciting opportunity when we can look at some of other countries in Africa and how they have used technology to expand access. There are really exciting opportunities. And what we need is investment in this space. We need to be attracting investment into the sector so that we can make full use of those opportunities to rapidly expand access to quality care to all South Africans. And that's what these amendments to the NHI bill are seeking, is a role for the private sector, a way that we can attract investment into this space. And then it wouldn't just be the medical schemes, but also the NHI fund, which would benefit from being able to contract with those entities that are able to provide this technology, which can rapidly expand access to care. We saw it during COVID. We leapt forward in terms of the use of tools like telemedicine, which we now have virtual access to GPs in really remote areas of the country, and we're really excited about the opportunity to build on that in terms of getting access to more people.
Prof, thank you very much for speaking to me. Of course, the Professor Roseanne Harris, she is the project lead for B4SA, and of course talking to us and just unpacking a bit about that session. She has just moderated on the National Health Insurance Bill. Of course, she's speaking to us here from the annual Hospital Association of South Africa conference currently underway at Century City in Cape Town, and of course for the balance of today as well as tomorrow, healthcare professionals, those in the medical space, administrators, policymakers are attending this conference, which earlier on the CEO told us is a flagship event in the calendar because it addresses the very critical issues facing not just private healthcare but healthcare in South Africa.